Hi, I'm Dr. Sarah Collins, and if you are over 60 and taking vitamin B12 every single day, I want you to stop for just a moment and listen very carefully. I promise this will only take about 30 seconds, but it could completely change how your brain, nerves, and energy respond to this supplement. You may think, I take B12, my blood tests are normal, so why do I still feel exhausted, dizzy, foggy, or notice tingling in my hands and feet? If that sounds like you are not alone. And most people don't realize there's a simple mistake happening that keeps B12 from actually helping you. I hear this question every single week in my clinic, and the story is always the same. Patients faithfully take their B12, sometimes for years, yet the fatigue, the balance problems, and the memory lapses continue, slowly sneaking up on them. That's why I made this video, to explain the exact reason B12 may be failing you, how to fix it, and how to finally see real benefits that you can feel in your everyday life. Before we go further, take a moment to notice your hands and feet. Are they tingling or numb? Does your brain feel slower than it used to? Do you forget words mid-sentence or struggle to stay balanced while walking? If so, you need to hear this information right now. Most adults over 60 assume that a normal B12 blood level is enough. You may have been told your lab numbers are fine and nothing is wrong. But here's the truth. Your blood can look perfectly normal while your cells, and especially your nerves, are quietly starving for usable B12. Vitamin B12 is essential for maintaining healthy nerves, supporting your brain, producing red blood cells, and giving you energy. Without it, your nerve endings begin to malfunction, often showing up first as tingling in your hands and feet, dizziness, fatigue, memory lapses, or that foggy feeling that makes it hard to focus. This isn't just uncomfortable. It can gradually affect your independence and your confidence. Here's what most people don't realize. As we age, our ability to absorb vitamin B12 drops sharply. By the time you reach 60, more than half of adults have lower stomach acid. Stomach acid is crucial because it separates B12 from food or supplements so your body can actually use it. Without enough acid, B12 passes through your system unused. I've seen this clearly with many patients over the years. One 71-year-old woman, Margaret, came to me complaining of burning sensations in her feet and frequent dizziness. Her doctor ran a B12 blood test, and the number came back at 420. Technically normal, they said. Nothing was wrong, they said. Yet her symptoms worsened every week. She was frustrated, feeling unheard, thinking maybe it was just aging. But what she didn't know was that her nerves were not getting the B12 they desperately needed. That's why just taking B12 isn't enough if it's not in the right form or being absorbed correctly. Another very common mistake I see is with the form of B12 seniors choose. Most supplements you see in stores are cyanocobalamin. It's cheap, stable, and convenient, but it is the least effective option for adults over 60. Cyanocobalamin is synthetic and must be converted by your body into an active form before it can actually work. This conversion depends on healthy liver function, certain enzymes, and antioxidants, all of which tend to decline with age. I had a 72-year-old patient, Robert, who had been taking cyanocobalamin faithfully for years. His blood tests looked normal, but he continued experiencing numbness in his fingers and struggled with walking. When we switched him to methylcobalamin, an active form of B12, things began to change. Within 1 month, his balance improved noticeably, and within 3 months, his numbness had decreased significantly. This demonstrates that the form of B12 you take can make all the difference. Taking a vitamin B12 tablet is not enough if your body cannot convert it effectively. The third big issue, and one that is almost always overlooked, is timing and consistency. Many seniors take B12 only when they feel tired, skip days, or stop when they feel a little better. B12 is not a stimulant. It is a repair nutrient, and your nerves require steady daily availability to rebuild and maintain the protective coating called myelin. Without consistent intake, the repair process is interrupted. I saw this with a patient named Elaine, 70 years old. She only took B12 on days she felt exhausted. Those days she felt a little better, yes, but her numbness, balance problems, and memory issues never improved. When she began taking B12 consistently every day without skipping a single dose, her symptoms started to stabilize. After 2 months, her tingling stopped progressing. After 4 months, her balance improved. That's the kind of change most seniors never see because they are doing everything right on paper, but missing these crucial details. Hydration also plays a surprisingly big role. Vitamin B12 works inside your cells, and nerve cells rely on proper fluid balance to absorb nutrients efficiently. Many adults over 60 are chronically mildly dehydrated, which reduces the nutrient transport into nerve tissue and limits the benefits of B12. And it's important to understand that certain medications can interfere with absorption or function, including acid blockers, metformin, and some antibiotics. You don't need to stop your medications, but you must know that these factors can influence how well your B12 is actually supporting your body. By this point, you may already notice a pattern. Most seniors aren't making one single mistake. They're making several small ones simultaneously. Each mistake alone reduces the benefit just a little, but combined, they can completely cancel out the effect of B12, leaving you frustrated after months or years of supplementation. Now, in Part 2, I will guide you through the exact steps, the right forms, the timing, the doses, and additional nutrients that ensure B12 works as it should in your body, so you finally experience more energy, clearer thinking, and healthier nerves. This is the protocol I use with all my patients over 60, and it consistently produces real results that are noticeable in everyday life. Now that you understand why B12 may not be working the way you expect, let's talk about the solution, the exact steps that ensure B12 actually supports your nerves, brain, and energy after 60. This is the approach I follow with my patients every day, and I've seen it transform lives when applied correctly. The very first thing to get right is the form of B12. For seniors, the most effective forms are methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. These are active forms, which means your body can use them immediately without having to convert them. That's a big deal because, as we age, the conversion process required for cyanocobalamin slows down, often leaving your nerves deprived even if your blood levels appear normal. This is why so many seniors take B12 for years without any improvement. Choosing an active form changes everything. Next is delivery method. If you are over 60, swallowing a standard B12 tablet with water often won't cut it. A sublingual B12, placed under the tongue and allowed to dissolve slowly, bypasses the stomach and the need for intrinsic factor. This allows direct absorption into your bloodstream through oral tissues, which is especially critical for adults with low stomach acid or digestive issues. I've seen patients regain balance and stop tingling within weeks after switching to sublingual forms, without changing the dose at all. Speaking of dose, many seniors assume a small tablet is enough. In reality, older adults often need higher amounts to overcome absorption barriers. A common effective range is 1,000 to 2,000 micrograms daily. Some may even need slightly higher doses initially, but don't worry. B12 is water-soluble, so any excess is safely excreted. The goal here is not to overwhelm your body, but to ensure enough B12 reaches your cells consistently. Consistency is just as important as dose and form. Take B12 every single day, not only when you feel tired. Nerve repair is a slow and steady process. Intermittent dosing interrupts this repair, leaving your hands, feet, and brain still struggling. One patient, a 70-year-old woman, began taking B12 daily without skipping, and within 4 months her balance improved, her tingling stopped, and she regained confidence walking independently. This kind of progress is what you should expect if you take B12 properly. Timing matters too. Many seniors take B12 late at night, which can interfere with sleep. Poor sleep increases cortisol, raises inflammation, and slows nerve repair. For most people, morning or early afternoon is the ideal time to take B12. This supports daytime energy and ensures your nerves get the nutrients they need without disrupting rest at night. It's also crucial to consider supportive nutrients. B12 does not work alone. Folate and vitamin B6 are often necessary to support full nerve repair and brain health. However, high-dose synthetic folic acid is not always tolerated well in older adults. Natural folate or methylfolate is generally better and safer. Pairing B12 with these supportive nutrients helps maximize absorption and nerve regeneration. Hydration plays a surprisingly significant role. Nerve cells rely on proper fluid balance to transport nutrients effectively. Many older adults are chronically mildly dehydrated, which reduces the ability of B12 to reach the tissues that need it most. Drinking adequate water consistently improves the effectiveness of B12, especially for nerve repair. You also need to be aware of medications that interfere with B12 absorption or function, like acid blockers, metformin, and certain antibiotics. This does not mean stopping your medications, but adjusting your supplementation approach and using the right form, dose, and timing will help overcome these challenges. Another critical point is monitoring your progress the right way. Don't rely solely on blood tests. Pay attention to symptoms. Are your hands and feet less numb? Is your balance improving? Is your thinking clearer? Lab numbers can give a false sense of security, especially in seniors, whereas actual functional improvements tell you whether your nerves and brain are truly benefiting. Long-standing nerve damage or structural issues, like spinal degeneration or diabetes, can limit the effect of B12. In these cases, B12 supports repair, but it cannot reverse severe damage overnight. High blood sugar also directly damages nerves. If you have prediabetes or diabetes, nerve symptoms may persist unless glucose levels are controlled. Chronic inflammation from stress, poor sleep, or sedentary habits also reduces B12 effectiveness. By addressing these factors alongside proper supplementation, B12 can finally deliver the results you've been looking for. Let me give you a real-world example. A 73-year-old man came to me frustrated because he had doubled his B12 dose on his own after reading online advice. His symptoms didn't improve at all. Further evaluation revealed spinal stenosis, meaning his nerves were being physically compressed. No amount of B12 alone could fix that problem. Once we treated the underlying issue and used B12 correctly, the supplement became supportive instead of disappointing. This is why knowing the proper approach and adjusting for your unique health situation is so important. Finally, let's emphasize that all these factors — form, delivery, dose, consistency, timing, supportive nutrients, hydration, and underlying health — work together. Most seniors are not making one mistake. They're making several small errors at once, each diminishing the benefit of B12. Correcting all of them produces noticeable, real-world results, including increased energy, improved balance, reduced tingling, and clearer thinking. In Part 3, we will bring everything together into a complete, actionable daily routine. I'll show you how to structure your B12 intake, combine it with other nutrients, and monitor your progress so you can finally experience the full benefits of this essential vitamin and regain the energy and confidence you deserve. This final part will make everything practical and easy to follow for anyone over 60. Now let's bring everything together into a clear, practical routine that ensures vitamin B12 actually works for you after 60. This is the step-by-step approach I give all my patients, and when followed correctly, it delivers real, tangible results you can feel in your everyday life. The first step is to choose the right form. Remember, not all B12 is created equal. For seniors, methylcobalamin or a combination of methylcobalamin and adenosylcobalamin is ideal. These forms are active, meaning your body can use them immediately without extra conversion. That's important because as we age, the conversion process required for cyanocobalamin slows down, which can leave your nerves starved even when your blood levels look normal. This simple choice alone can dramatically improve your energy, memory, and nerve health over time. Next is how you take it. Sublingual B12, placed under the tongue, is far more effective than standard tablets because it bypasses stomach acid and intrinsic factor. This ensures that the vitamin enters your bloodstream directly and reaches the tissues that need it. I've seen patients regain balance, reduce tingling, and even think more clearly within weeks of switching to sublingual forms, without changing the dose at all. Speaking of dose, most older adults require higher amounts than commonly recommended for younger people. A safe and effective starting range is 1,000 to 2,000 micrograms daily, sometimes slightly higher initially for maintenance. Don't worry about overdosing. B12 is water-soluble, and your body will safely excrete any excess. The key is to take enough consistently so your nerves can actually repair themselves. Consistency cannot be stressed enough. Take B12 every single day without skipping. Nerve repair is a slow process, and intermittent dosing interrupts progress. I had a patient in her early 70s who only took B12 when she felt tired. On those days, she felt a bit better, but her numbness, balance issues, and memory lapses continued. Once she committed to daily intake, within 4 months her balance improved, tingling stopped, and her confidence returned. This demonstrates that real results come from steady, consistent use, not sporadic doses. Timing also plays a role. Many seniors take B12 late at night, which can disrupt sleep, increase cortisol, and slow nerve repair. For most people, morning or early afternoon works best. This timing supports daytime energy and ensures that your nervous system has access to B12 when it needs it most, without interfering with rest. Supportive nutrients are another key factor. B12 works best alongside folate and vitamin B6, which help maintain nerve health and support brain function. However, high-dose synthetic folic acid may not be tolerated well by older adults, so natural folate or methylfolate is generally better. Combining these nutrients with B12 maximizes absorption and supports full nerve repair. Hydration is often overlooked, but essential. Nerve cells rely on proper fluid balance to transport nutrients effectively. Chronic mild dehydration, which is very common in seniors, reduces B12 effectiveness. Drinking adequate water daily ensures your nerves and brain cells can absorb and utilize B12 properly. Medications can also interfere with B12 absorption or function. Acid blockers, metformin, and some antibiotics are common culprits. This does not mean stopping these medications, but it does mean adjusting your B12 strategy to overcome these challenges. Using the right form, dose, and timing helps bypass these barriers and ensures you get the benefits you deserve. Monitoring progress the right way is critical. Don't rely solely on lab numbers. Watch your symptoms. Are your hands and feet less numb? Is your balance improving? Is your thinking sharper and clearer? These functional changes matter far more than a single lab result. Many of my patients see huge improvements even when their blood numbers barely change, because cellular uptake and nerve repair are happening behind the scenes. It's also important to recognize that B12 alone cannot reverse long-standing nerve damage, spinal issues, or chronic disease. In such cases, B12 supports repair, but cannot fix structural problems overnight. High blood sugar, chronic inflammation, poor sleep, and stress all limit B12 effectiveness. Addressing these issues alongside proper supplementation maximizes results. Here's a simple, actionable daily routine I recommend for seniors. Start your day with sublingual methylcobalamin or a combination with adenosylcobalamin in a dose of 1,000 to 2,000 micrograms. Take it in the morning or early afternoon, consistently every day. Pair it with supportive nutrients like methylfolate and B6, drink plenty of water, and monitor your symptoms rather than just lab results. Adjust your routine based on how your body responds. Finally, remember this. Taking B12 correctly isn't just about numbers. It's about how you feel, move, and think every day. One patient, a woman in her early 70s, had been taking B12 for years without benefit. Her form was wrong, she swallowed tablets inconsistently, and she judged success by labs alone. After switching to the right form, using sublingual delivery, and taking it daily, she told me, "I feel steady again. I trust my feet when I walk. I don't lose words mid-sentence anymore." That is the difference between taking a supplement and truly using it correctly. Vitamin B12 after 60 is not optional. It's essential, but only if you follow the right routine. Tonight, review your B12 habits. Ask yourself, is this actually supporting my nerves and brain, or am I just checking a box? Comment below with your age, location, the form of B12 you're taking, and any changes you plan to make. I read every comment and love hearing from our community. Share this information with someone you care about. Many seniors are unknowingly taking B12 the wrong way. When you follow the right steps, form, delivery, dose, timing, consistency, supportive nutrients, hydration, and monitoring, you can finally experience real improvements in energy, balance, and brain clarity. I'm Dr. Sarah Collins. Stay strong, stay healthy, and remember, vitamin B12 works, but only if you do it correctly. Make the small changes today, and your body will thank you for years to come.